This is our first aid kit basics video. So the point of this video is to go through what you can generally find or add to your first aid kit for general treatment of anything kind of in that first aid scope. So let's start off with personal protection. So first thing you got is gloves, which should generally be worn to always protect yourself from bodily fluids with the patient. You got your standard kind of vinyl gloves and nitrile. Both are latex free, so you're not going to cause any allergic reactions. The nitrile a little bit more tactile, a little bit more flexible and tear resistant, but either will do. Then you've got a CPR face shield. So this is for when you need to give mouth-to-mouth resuscitation to a patient as part of CPR. That's a little bit more advanced than your layperson CPR course, but as you step up in the levels, we find this is more important for specifically adults with a respiratory cause like drowning or an overdose, or with kids that generally have a cardiac arrest from a respiratory cause. So these face shields are made to go over the whole face. They have a one-way filter valve to protect you from any passive exhalant from the patient that may have any disease or condition. And these have instructions right on them to go over how to use it. So a pretty awesome little protective device, and goes quite small here. Then we get into wound care. So with wounds, we have kind of three basic types of gauze that you'll find in kits. The first is a non-adherent pad. So this guy here, it's a little bit shinier, really tightly woven. So these are designed not to stick to the wound. They're great for burns or any areas where you don't want clotting to happen, like a minor abrasion or cut. This is what you'll find on the inside of any bandages or band-aids, so that it doesn't stick to that wound and then tear it off as you're bringing it off. This is your standard gauze. You can use this generally, add water and brush a wound, clean of debris and bacteria, or you can add this to somewhere that is bleeding that you want to kind of clot off for now to help stop and control bleeding. So that's your gauze pad, and it comes in a variety of sizes. And then you have your larger abdominal pad. So this is a large gauze pad with a filler in it. So this can be used to cover a bigger area of wound and really help control bleeding. So if you place this over somewhere that's bleeding a lot and added some really good pressure on top, this is going to be better for controlling that. Then you have roller gauze. So this is this type of gauze here in a large roll that kind of rolls out. And this can be used to secure any of these dressings to a patient. So it'll actually wrap around, their arm or their leg and help hold that gauze in place once you've applied it. Then you got bandages. So a few different types here. Fabric generally lasts a bit longer and holds for the day, but plastic will do as well. This is a fingertip bandage. So this would actually go over the fingertip and fold over to control any bleeding kind of right on the tips of your fingers. This one's a knuckle, so it's going to go over the knuckle areas, and it's a little bit more contoured so you can still flex that finger, but it'll protect it. This is the island bandage. This is good for kind of any larger area, arm, leg, elbow, or knee, and it's really going to cover a larger kind of abrasion. And then you have your standard Band-Aid, and this is for anywhere in between, little cuts and nicks, and it'll just help keep it clean and keep it covered. Then you have your butterfly or steri strip, and these are good for lacerations, so kind of a line cut where it might be a little bit open. Generally, we only want to be doing this for lacerations, less than an inch in the first aid world. Want to make sure we clean it really well before we do that. If it's anything larger than an inch or really wide and not closing up well, those should go to the hospital to get some sutures and a really good cleaning to make sure they don't get infected. Then we have some ointments and swabs. So the first one here is a cool gel. This is a burn gel. So this can go on minor burns, your superficial, partial thickness. You can add this right to it, or actually add this to the non-stick gauze to provide some cooling relief and prevent that gauze from sticking to the burn until it's assessed. This is our BZK swab, or benzalkonium chloride wipe. This is great for cleaning any minor wounds, abrasions, cuts, scrapes. It's non-sting. It doesn't have alcohol in it, so this is going to clean really well and provide a nice cleaning to get any junk, debris, or kind of bacteria out of the wound. And then you have your alcohol swab, and this is commonly misunderstood. So really, the purpose of this is not to clean open wounds. This is more to clean your tools or kind of sterilize closed skin areas when we do like injections in more of a medical world. But in a first aid sense, generally what I would use this for is cleaning my tools. So some of the tools I'd have in a first aid kit, a really nice pair of fine point metal tweezers. This is great for, pulling off splinters, getting out ticks, removing any little debris from a wound, and cleaning this with the alcohol swab. Just make sure you're not introducing any new bacteria to that wound. Then we have scissors. Again, this is a bit of a misunderstood item from what I've seen or heard out there. This is not used to cut the patient. This is used to either remove clothing so you can see where an injury is. Say there's bleeding through pants and you need to like open a little window to where that bleeding is to find where that cut is. Or you can also use this to cut up your gauze into smaller pieces to kind of fit a smaller wound. So these are your trauma shears, paramedic scissors. Other scissors would do. These are generally just a little bit stronger and they're made to cut through more material. Then you got some tapes. So this is a clear medical tape. It's porous, so it actually allows some breathing to go through it. So it's going to kind of do well for the skin and not do as much damage. And then this is your cloth tape. Again, it will breathe a bit. This is a little bit stronger adhesive, and this is generally good for like taping injuries like a rolled ankle, or even preventing hot spots from becoming like open blisters. So around your heel of your foot, fingers, kind of feet. That's where the athlete's tape's really good. You can also use this to secure any of the gauzes there, secure a splint. Then you got a cold pack. So this is great to reduce swelling for any muscle injury. You just pop these and they last, roughly 15 minutes. You got to be cautious. These do get really, really cold. So if you put this right on the bare skin, you can cause some frostbite if you're not paying attention, especially with a kid. So generally good to wrap this up in something like a triangular bandage just to provide a protective layer before it goes on the patient. Then you have your triangle bandage. So this folds out to a big triangular sheet of fabric, and this can be used to tie onto a patient to control bleeding. It can be used to attach a splint, make a sling, a number of applications in first aid. It's a really versatile tool, super small. It comes with some safety pins to help secure it, so definitely worth getting. And I often stock a few of those in my first aid kits. Then you can get into splints. So these are just rigid. A splint is a rigid piece of material that's going to help control kind of a broken or suspected broken bone area from moving around. This particular one is a moldable one. It has a padding of foam on it. So you can actually open it up and it gives you directions on different ways that you can actually use it on here. And this is great to help control an area that you're worried is broken while they go to the hospital. So in a car, they're a little bit more comfortable. Kind of with that, you can attach that with elastic wrap, which is this here. It's kind of an elastic fabric that rolls out, and you can, again, wrap this around an area that has some swelling in it as a compression. It can be used to control bleeding as well in combination with something like the abdominal pad. So the elastic wrap is a great one to have. And they come in different sizes. This is a 3-inch roll. I find it's the most versatile, kind of does everything roll, but you can get 2, 4, and 6 inch as well. Then you have a tongue depressor or a popsicle stick. These are great for finger injuries. So if you had someone that hurt their finger and they couldn't move it well, you can tape it to this as well as a secondary finger with some of your cloth tape or your medical tape, and it'll just help splint it so the patient's not straining to try to keep it from moving while you're going to the hospital to get it checked out. Then you have your emergency blanket. So these are Mylar foil blankets. These are meant to help retain heat. So especially in trauma patients, anyone who is significantly ill or injured, they lose a lot of heat, and we really want to prevent that from happening. So wrapping them up in a blanket can help save some of that heat loss and keep that patient a little bit better while you're waiting for an ambulance or taking that person to get some more medical attention. Then you got a thermometer. Particularly important with kids when you're dealing with fevers and you're trying to manage a fever at home and see if your Tylenol, Advil work to help bring down a fever. You can see how infection's doing, track it over time. So this is a pretty basic one. You can use this orally. It can also go under the armpit, or you can do these rectally too. That's maybe a little bit more beyond first aid, but they work quite well. This one comes in a nice little case and it's digital. It only takes 10 seconds to read. So they're pretty good little devices there. Then I like to keep a reference on hand. So this is a little first aid basics guide that kind of goes through, my general how to react in a first aid emergency, how to do some basic things like CPR, and some splinting. So this is great to have on hand. You don't always remember all that training, so having something there as a quick reminder, that's really helpful. And you can get a number of different guides to go in there at different levels. Then I like something to record information. So if I'm doing first aid and I want to send my patient off to the hospital to get some further attention, I'd really like to let them know what I did. And, trying to tell someone all that, you often lose it in the voice. So writing it down is better. So having a form like this where you can write all that information and then hand this off to the patient to take with them to the hospital or to the paramedics when they go, that's a really helpful piece of material to have. And then with that, it's important to kind of keep track of some important things. So important numbers like poison control, crisis line, kids help phone line, and then some personal contacts like any emergency contacts that you would have if you're working at a workplace, who to call if someone gets injured, any local resources that are specific to you that might be helpful. That's a good area to kind of keep track of that and keep that in your first aid kit where it's going to be really helpful. Now, most of us have some smartphones now, and there's some really good apps that you can download. So the Red Cross has a free first aid app. This is it here. It's got a ton of different things that you can do. It even has emergencies, so you can actually go right into an emergency area, and it will prompt you as to what to do, and even gives you a quick access to a 911 button to call. So this is a great little resource. It's actually free to download, so it's the Red Cross First Aid app. So that's a good one there. And then finally, some sort of container to keep all this stuff together. So your most basic, a Ziploc bag, something to keep this stuff weather resistant, because really you want a first aid kit to be accessible. So I'm going to take this kit with me kind of wherever I'm going. So in a little Ziploc bag, it can go then in my backpack or in a pocket in my car, kind of keeps everything together and a little bit weatherproof. Then you can kind of step it up to like a nylon bag. So this sort of bag would allow you to have some organization. You got some different areas where you can store things, a little bit easier to access things and know where everything is, a little bit more protected. It's got a handle here and a little clip. And then you can also put your items in different Ziploc bags in here just to keep them extra protected and organized. And then if you're going kind of really out there and you wanted something more durable, there are waterproof cases that can actually be locked down. So you can keep this like in a boat, at a cottage, in a remote area, and it's going to be weather resistant. And then inside, again, you can organize things with Ziploc bags and kind of different areas to it. So this was an overview of a first aid kit basics. So just giving you some ideas of what you would add in a first aid kit, how you would build it. We'll put a link to all these items on our page here. And if you're looking for any of this equipment, feel free to visit wildmedkits.ca.